A personality is what makes us unique. It's how we think, feel, and behave. A personality disorder is when this deviates strongly from societal expectations and can cause trouble in functioning normally. Borderline personality disorder is a cluster B disorder in the Diagnostic and Statistical Manual 5th edition. It is also known as emotionally unstable personality disorder in the ICD classification. It is characterized by strong emotional responses, unstable interpersonal relationships, and a distorted sense of self. There are 9 core signs and symptoms, which are a fear of abandonment, which can be real or perceived abandonment, and people with this disorder will make frantic efforts to avoid abandonment. Unstable relationships with other people. Part of this is because their feelings towards others can change from being close to extreme dislike very quickly. This is linked to splitting, which is a defense mechanism in which people are seen as either entirely good or entirely bad. Next, there is a disturbed sense of identity or feeling uncertain about themselves, impulsivity or reckless behavior like unsafe sex or substance abuse, recurrent suicidal ideation or self-harm, emotional dysregulation and mood reactivity, which can last from hours to days. Then there are feelings of emptiness, uncontrollable anger, and severe dissociation or stress-related paranoia. To meet the DSM-5 criteria, 5 of these 9 features need to be present across a variety of contexts. It is usually diagnosed in early adulthood, but can be diagnosed in under 18s. It is thought that a combination of genetic, environmental, and social factors result in borderline personality disorder. It's estimated that 1 to 2% of the general population and 20% of the inpatient psychiatry population are affected. Studies have previously noted a higher female to male ratio in clinical settings. However, when applied to the general population, it seems roughly equal. There is up to a 69% heritability, which is the extent to which genes make up a trait, and a correlation in twin studies. But it may be that these results are skewed because twins tend to have similar environments. There is a strong correlation between child abuse, including emotional, physical, and sexual abuse, an unstable family environment, and the development of borderline personality disorder. 70% of patients are thought to have experienced abuse or neglect in their past. Having borderline personality disorder can make completing school and keeping a job difficult. There's also the partaking in risky behaviours like unsafe sex and reckless driving, which can predispose to harm. Overall, 10% of patients will die from suicide. Patients are also likely to have another disorder, such as mood disorders seen in 80 to 96% of cases, anxiety disorders in 88%, substance abuse in 64%, eating disorders in 53%, attention deficit hyperactivity disorder between 10 and 30%, and bipolar disorder in 15%. No medication is currently approved specifically for borderline personality disorder, although some classes like anticonvulsants, antidepressants, anxiolytics, or antipsychotics are prescribed sometimes. Psychotherapy or talking therapy is the mainstay, and 3 main therapies have been identified in particular. Mentalizing-based therapy is used to help manage the emotional dysregulation and help in feeling understood. Ultimately, this allows patients to make fewer assumptions about the intentions of surrounding people. It is sometimes referred to as thinking about thinking. Dialectical behavior therapy involves using interpersonal skills and mindfulness to achieve emotional regulation and help to reduce conflict in relationships. Transference-focused psychotherapy helps raise the patient's awareness to the interpersonal issues and self-destructive behaviors.